public statement is that 20 million Americans have gained coverage under Obamacare. As always, the devil is in those numeric details. And the devil would seem to be comprised of facts the administration would prefer you are not aware of. Or at least if you are aware of it, you don't pay much attention. Welcome into MidPoint from the Heritage Foundation, and a writer for the Daily Signals, Alyene Senger will join us here momentarily because we have to look at a story that talks about the fact that under 20 million, check that, over 20 million Americans gained coverage under Obamacare. The story that comes out is from a new report from the Commonwealth Fund. It claims that these 20 million Americans gained coverage under the Affordable Care Act as of May 1st. But it's, again, that devil in the details that we always have to work our way towards. The devil in the details here is simply the numbers and where they come from. Now, the authors, and this is something that we're going to have Ms. Senger talk about here because, frankly, it is always the numbers and how things are figured out, and that is a lot of what the controversy always is when it comes to Obamacare. The authors are Dr. David Blumenthal, who is the president of Commonwealth, and Vice President Sarah Collins. Now, they got to the 20 million here in a very interesting way. They added together 1 million adults who gained coverage under a parent's policy, 8 million consumers who selected a marketplace plan, 5 million who purchased directly from an insurer, and 6 million who enrolled in Medicaid or the Children's Health Insurance Program. Now wait, there's more numbers here. The authors even admit to the general public that the 20 million figure does not distinguish between those who were previously insured and those who were not. So there's a little bit of a question as to exactly whether these are new, whether these are old, where they came from. This is even though the previously insured would not be gaining coverage, but merely replacing one form of coverage with another. So what we're talking about here is 20 million Americans gaining coverage, but it's not really 20 million gaining coverage. I mean, it is if you use semantics here. You can say that they are now gaining coverage under Obamacare, but it really isn't whether or not this is something new. Then there are 5 million who purchased coverage outside of the exchanges. All this and so much more. Once again, Alyene Senger from the Daily Signals joins us today on MidPoint. Alyene, thank you so much for being with us.
Thank you for having me.
Here we go now. I've just been going over some of the numbers here, so we don't have to do it again, but it talks about 20 million Americans gaining coverage under Obamacare, and we're looking at numbers and where they get them from, and 5 million here and 1 million here. But isn't that the way most things are done in the first place?
Yeah, I think with Obamacare, especially, you see that people tend to count things differently than they should, and it's always apples to oranges. It's never quite the comparison that it's supposed to be. And this is another instance where they're saying that these people gain coverage because of the law, but in reality, the individual market existed well before Obamacare, and these people were purchasing there beforehand.
When we use the words gained coverage, that sounds as if it's something new. You've been allowed in. You've been given something. But isn't it fair to say that in the gaining coverage, it is out there? It was pseudo easy to get, at least. It's not as if you had to fight for it, but the coverage was there and it was made available to you. So again, gaining is sort of almost a semantic way of adding to it. How am I doing here? Am I at least following the right way of where the semantics are going?
Yes, absolutely. You're explaining it absolutely correct. And another difference is whether or not they had insurance before or whether they're gaining it for the very first time. This market existed before, like I said, and in 2013 there were about 16 million people who purchased there. So if that declines to only 5 million, well, that's a decrease in coverage, not a gain in coverage for this particular market. But this speaks to the complexity that is Obamacare, because we have plenty of different places where people can purchase coverage, and they're all interacting together. You mentioned Medicaid as a place for people to gain coverage. There's the exchanges. There's the outside of the exchanges, the individual market, but then there's also employer-sponsored insurance. So there's too many interactions and too many apples to oranges comparisons going on in this particular report.
All right, Alyene, I'm going to play a little devil's advocate here, which I have always loved to do when it comes down to any issue whatsoever. There are those people that are going to say, hang on a sec, big deal, gained is not that big a word. People are still getting better insurance, what some people believe is better insurance. And they'll say that really what we're doing here is really picking tiny little things here and trying to make a mountain out of a molehill. How would you answer those critics whom you know are out there right now and are hearing what you're saying, and they're saying that exact thing?
I certainly think that saying 20 million got coverage because of the law is an exaggeration, and I think that of course, there was an individual mandate for these people to purchase insurance, and Medicaid coverage is free for the consumer to go and get. So 6 million people signing up isn't all that shocking. And there are 8 million people that are supposedly signed up to gain coverage in the exchange. I'm not negating that those are coverage gains for Medicaid or the exchanges. I'm saying that let's call it what it is. And the CBO, if you're going to cite the CBO as saying there's 5 million people that are getting coverage in the individual market, then you need to explain that the following paragraph said that in the absence of the law, there would be 9 or 10 million people getting coverage there. So I think for the purposes of educating the public, we need to make sure we're giving them the whole story.
Okay.
So yes, 5 million people will get coverage in this market, but without the law, it would have been almost double that.
You mentioned the words educating the public, which I think are always interesting, because a lot of times that is what we are trying to do here. We are giving them the facts. We are giving them the actual reality here. But why then is it that America is not learning? If we're educating them and we're giving them the facts, it seems as if many times it just gets glossed over. And again, it comes down to the critics who say it's no big deal. What's it going to take to actually get people to understand these numbers and be able to accept them and then be able to see that what they are being handed is not exactly the truth?
Well, I think the American public does get it, at least on some level, because a majority of Americans haven't liked this healthcare law since it was passed up until today. So we still have more people not liking the law than liking it, and I think that says a lot. Whether or not they understand the difference between exchange and non-exchange coverage doesn't necessarily matter. It's how it impacts them. What does it mean at their kitchen table? Have their premiums increased or decreased? Were they able to keep the plan that they liked? Do they have a real choice in insurance, or are they forced to buy the plan the government thinks is best for them?
All right, let's also look at Medicare reforms here, because as you wrote in another recent article here on the Daily Signal, you talked about the accountable care organizations were expected to deliver better care at lower costs. What did you find to be the reality here?
Well, the accountable care organizations haven't been delivering the kind of savings that the Medicare program needs. There are some savings there. A majority of ACOs aren't getting the savings that they need to get. But the point of that is that the Medicare program is in dire need of structural reform. We have a trust fund that's going to be bankrupt by 2026 and a long-term unfunded obligation of $37 trillion. And what that means is that the government, as it stands now, will have to pay out $37 trillion worth of benefits to seniors that it does not currently have the money to pay for. So while an ACO, I don't know how you feel about them, maybe you think they're a good idea, it doesn't matter. At the end of the day, they are not significant enough to save this program for current and future beneficiaries.
Is one of the bigger problems here that we're missing is a lack of doctors? Because as I talk to doctors on the ground all the time, there are many who are retiring, many who say they do not want to become a part of the affordable health care system. They're tired of it. They feel they're being jammed into it. And we're also looking at fewer doctors coming out of colleges over the next few decades. So are we not also looking at a disaster here that, simply put, whatever plan you have, Obamacare simply does not address this?
Absolutely. We were projected to have a doctor shortage before Obamacare, and we're certainly projected to have one now because Obamacare has further demoralized the patient-doctor relationship and made doctors feel worse about what's happening today. They're expanding government programs that don't pay them as much as they deserve to be paid. So certainly the doctor shortage is still on the horizon, and we need to start implementing policies that begin to address it.
Is there a possibility here, and is there a hope from some people who are critics of Obamacare, that the Supreme Court certainly chipped away a little bit at it in the recent decision in Hobby Lobby, but that the Supreme Court, there may be another shot at Obamacare through the Supreme Court?
I don't think the Hobby Lobby decision, it doesn't necessarily get at the core of Obamacare. It protects these companies' religious liberty, but as far as the whole of Obamacare, Obamacare is so much more than that contraception mandate. It mandates all kinds of benefits and mandates what kind of coverage you have to have, what level of coverage you have to have, and just the fact that you need to purchase coverage or pay a fine. So I think that there's certainly a lot more to be done to getting at the core of this law. I think that's a small step. It's a good step for protecting these companies from Obamacare, but the rest of the American public needs to be protected from its various consequences.
That is exactly it, and that's what many of the critics of Obamacare are saying, that it is a small step, certainly not a big one, but something that may lead to something else down the road. Alyene Senger from the Daily Signals, thank you so much for joining us. We appreciate your time. I'm sure we'll do it again.
Sure, thank you very much for having me.
And let's also let everybody know here that there is something coming up here this week, too, because there's a 3-judge panel from the D.C. Circuit Court of Appeals that is expected to hand down a ruling sometime this week or soon whether or not the federal government can give subsidies to Obamacare recipients in states with federally run health care exchanges. Now, there's a lot of words going on in there, but it still means that, again, there is another court challenge, and there are those who see the Hobby Lobby case, they take this, and they think that it is indeed that chipping away at Obamacare and needing to get Americans where they really need to get, in their opinion, in health care. We'll get you there. Don't worry about it. This is MidPoint, where every day we question everything.